Hi, everybody. Today we're going to be going over how to set up the Trilogy 202 ventilator. It is the ventilator we use at Cobble Hill ED to give non-invasive or CPAP or BiPAP and invasive ventilation to our patients. So we're going to need a couple of supplies from the clean supply room. So we have our RT219 circuit, we have our HEPA filters, we have our suction catheter, we have a BiPAP mask, we have our Verso adapter to attach the suction to the circuit, as well as our end-tidal CO2. So first, we're going to start off with our machine and setting up our main circuit. So we're going to grab that RT219 circuit. Inside of the packaging, we're not going to use everything. So we're going to throw away what we don't need and take what we need. So we need this clear piece, which is called the DEP or distal exhalation port. That's how the patient's going to exhale. And then in the circuit, we're also going to take out the much longer or the thicker blue tubing. We're going to turn the machine to the side or come over to the side. First, apply the HEPA filter to the machine. This is going to help filter out anything that the patient is breathing out into the machine and vice versa. Then we're going to take the weird angle of that bigger, larger bore tubing, and we're going to put that to the HEPA filter. Then we're going to attach our DEP. With the DEP, remember to keep the double rings going towards the patient or towards the mask. Then, if we're going to prepare for BiPAP or CPAP, we have our mask that's well fitted for our patient. If we need to add in a nebulizer treatment, we're going to take our new nebulizer T. Do note that there's two different sizes on this one. With this inline valve, we're able to give less flow to our patients, as well as if the acorn comes off, it will not open up the circuit to the rest of the environment. So it's going to be placed there, and then we're going to add our DEP and mask back in line. Then to add the nebulizer treatment, you're just going to take the acorn and put that into the nebulizer T, and you are ready to give your patient BiPAP or CPAP and a nebulizer treatment. If we are setting up for ventilation or an invasive setup, we are going to take off our mask. We're going to add our end-tidal CO2. This is the gold standard to making sure that we have an airway in a proper place. Then we're going to add our Verso adapter, which is just a suction adapter, and our inline closed suction for our patients. Rule of thumb, the inline suction should be 2 times the size of the ET tube of your patient, give or take. Then you're going to attach the end of the Verso adapter to your patient's airway, so either an endotracheal tube or to a tracheostomy. And then we have, of course, once again, the anchor fast to hold the ET tube in place. For the invasive and non-invasive, the setup is pretty much the same with a few differences.